Hello, and welcome to the new channel of Ricu, Ricu Express. Just to quickly introduce your hosts, I'm Gedalia May.
And I'm Daniel Fuchs. Welcome to the Ricu Express, where we keep you up to date on the latest in clinical research. We know how busy you all are as med students or residents. It's sometimes hard to keep up with all the latest literature. So in 10 minutes or less, our goal is to review research articles from top-tier medical journals and give it to you, Express.
Today we will be reviewing 3 articles that came out in the recent JAMA, Journal of American Medical Association, volume 326, number 20, which came out November 23rd, 2021.
So what's the topic of the first article, Gedalia?
The first article deals with knee osteoarthritis.
Did you know that knee osteoarthritis is a very common cause of disability that affects approximately 260 million people worldwide?
I actually did know that, but back to the article. What the authors of this article would like to find out is if intra-articular injection of platelet-rich plasma, PRP, improves symptoms and joint structure in patients with knee osteoarthritis.
This is an important study because clinically, a lot of doctors are using PRP for osteoarthritis, even though most clinical guidelines do not recommend PRP for knee osteoarthritis because of lack of any high quality evidence on efficacy for symptoms and joint structure. Yet doctors are still giving it. So how did they do this study, Gedalia?
So it was a randomized clinical trial that included 288 adults aged 50 years or older with mild to moderate radiographic knee osteoarthritis. 144 people got the treatment with PRP, and the other 144 got placebo injection. The results from this study showed that there is no statistically significant change in knee pain or change in medial tibial cartilage volume at 12 months.
So are you saying that among adults with mild to moderate knee osteoarthritis, treatment with PRP did not significantly improve knee pain or slow disease progression? So basically, we should not be doing it?
That's right.
Well, that's a wrap for the first article. On to the second. In another article this week, the authors wanted to follow trends of weight change in America for the last 40 years. Are people getting fatter, skinnier, the same? I have my guesses. Tell us what the article said, Gedalia.
Okay, Daniel. So the article used nationally representative data from the National Health and Nutrition Examination Survey to assess people's average BMI over the span of those 40 years.
And what did they find?
They found that the mean BMI increased from 23.1 to 27.7.
So just as I suspected, we're getting fatter.
And the prevalence of obesity among emerging adults in the US increased significantly.
Very good. On to the next. This next article is looking to find out if patients with NASH, non-alcoholic fatty liver disease, and obesity, does giving them bariatric surgery change their risk for major adverse liver outcomes, or does it change their risk for major adverse cardiovascular events?
This is a very important study, Daniel, because from what I read, there has been no therapy that we can give patients with NASH that have been shown to reduce adverse events.
I was just thinking that this is pretty ironic that we're discussing this case right after the article about how people are getting fatter, because obesity is a big contributing factor to NASH. Anyhow, NASH is also the leading cause of cirrhosis and hepatocellular carcinoma, and is also significantly linked to cardiovascular disease. So if we can do something to help these people, that would be really good. So Gedalia, what were the results? Did it work?
So yeah, it worked. The data shows that patients who had NASH and obesity who got the bariatric surgery did have a lower risk for major adverse liver outcomes or major adverse cardiovascular events.
Oh, that's awesome.
That's all we have for you today.
Express as promised.
Thank you to all of our listeners.
If you have any questions or comments, please email us at thericuteam@gmail.com. Write Express in the subject. Follow us on Spotify, Instagram, Facebook at The Ricu Team. As always, thank you for listening. Have a good day.